Hi, everyone, and thanks, CJ, and thanks everyone for being here. I'm Polly Dunford, President and CEO of IntraHealth International. It's been an intense few weeks in the world of global health with the UN General Assembly, the COVID 19 Global Summit, a series of global reports, and meetings that are looking at the future of global health in a world fully in the midst of a global pandemic. During this global pandemic, we need to be focused on health systems, health workers, global health architecture, and funding to achieve the goals that we're setting out. So, what are the possibilities? Who pays? And how do we as a global community get this achieved? So, joining me here today to discuss these issues are Kalipso is the founding head of the Global Fund's Health Financing Department, responsible for driving the domestic resource mobilization and blended financing agenda and enhancing the Global Fund's application of value of money principles. Thank you, Kalipso. Also joining me today is Santiago Cornejo. Hi, Santiago. He's the Director of Country Engagement in the Office of COVAX Facility and is the Director for Immunization Financing and Sustainability at the Gavi Alliance to enable the sustainability of immunization achievements in Gavi's transitioning countries. Welcome, Santiago. Also with us today, we're lucky to have Edwin Ikhuoria, the One Campaign's Africa Executive Director, leading One's advocacy work across the continent. His advocacy work covers pro-poor policies and transparency in public finance, so important, health, agriculture, food security, environment and trade, and engaging policymakers and African civil society groups. We're also honored to have Githinji, the global CEO of IntraHealth Africa, the largest Africa-based healthcare nonprofit. Dr. Gitahi is also the steering committee co-chair of UHC 2030A, a World Bank and a World Health Organization global initiative for universal health coverage. So welcome, everyone. We're honored to have all of you today, and I'm looking forward to a really robust discussion on all of these important topics. So first, perhaps I'm going to ask Kalipso the first question. So today we're talking about the future of healthcare in Africa. Who pays? And to truly manifest the future we are working towards. So could you tell us more about your vision at the Global Fund for a sustainable, achievable, healthy future? And what are the challenges and how do you envision that we actually get there?
Thanks very much, and thank you for having me. So it is a big question you're asking. I'll try to be brief, but first of all, let me sketch out the characteristics of the future of health in Africa. First of all, it has to be locally driven. It has to be made in Africa, inclusive, able to address Africa's health challenges. It's all about locally owned and locally implemented solutions, and that's why the Global Fund, we refer to the Global Fund partnership, a partnership that comprises communities, national governments, the private sector. All of these players are integral to the way the Global Fund operates. Secondly, it's a future, it has to be a future that's driven by data, driven by information, by evidence. And these are data that would inform decision makers' decisions, but also empower people to hold decision makers to account. Make data not for the sake of data, but data that actually are meaningful and allow stakeholders to run their systems and report back to their people. Thirdly, it has to be about outputs, about outcomes, about results, a lot more than it has been so far. So it's about the frontline services that are delivered to people, quality of the services, what the money actually buys us, who gets access to services, and how the global norms ultimately get translated into local contexts and make sense. And then it's also about equity, which is important and critical, the distributional implications of decisions about allocating resources. And so we follow the Global Fund, the 11 guiding principles of the Africa Union, the Africa Union Health Strategy, which was set out for 2016 to 2030. And equity is one of those guiding principles. So services have to be available to people who need them, and the poor should not be effectively made poorer by prohibitive out-of-pocket payments. And colleagues before me have flagged these important issues. So it's about access for people who need care, women and girls, poor, in a way that does not make them even poorer. Now, if I can talk about who pays, as people mentioned before me, and you have just also highlighted this pandemic. This pandemic is a global health crisis that triggered a global economic crisis. And anyone who was not convinced before that health is macro critical should by now have ample evidence that that's absolutely the case. So the pandemic has also highlighted how health systems globally, but especially in Africa, have been chronically underfunded, especially in lower and lower middle income countries, most of which are in Africa. Now, we've heard about sources of financing for health, about donor support, which in fact has been increasing, but that reliance is not sustainable, and about out-of-pocket spending, which has also been going up in many countries. And that's not the way to finance health. Health ought to be financed predominantly by governments, to much lesser extent the role for donors or for out-of-pocket payments, or indeed other sources, employers or private health insurance. These are, especially private health insurance, a minuscule part of the pie. But unfortunately, we know that out-of-pocket payments are a major source of financing in 29 countries across Africa. That was in 2018, where government expenditure on health was the major source of funding only in 20 countries. So we know that government expenditure on health was only more than 50% of the total spend on health in 5 countries, whereas out-of-pocket spending was way above 50% in a total of 13 countries in Africa. That is a sad story. And the story has gotten even worse with COVID. We know that the COVID pandemic has effectively impoverished people. And if we don't see people spending out of pocket, that's not a good thing now. It's because most likely those households have become impoverished because of the economic shock of COVID. So in conclusion, and I'll finish, I think to achieve a sustainable universal health coverage and ensure equity, governments have to commit more resources on health. But it's not just about more money, it's also about how the money is spent. Many countries spend a lot on health, including the richest country in the world, spends a lot on health, more than anyone else, but they don't necessarily get good health outcomes and equitable health outcomes. So we need to think about value for money, about efficiency, about distribution. And process also matters. So we need to make sure local leaders and local communities are in the driving seat, are involved in decisions made about them through the investment in health. And finally, and I'll conclude, I think it's absolutely critical that we as a new Health Finance Department, the Global Fund, serve you as a resource, serve the community of decision makers, of communities, of people who access services in Africa, and support the sustainable health financing agenda, whether it's through health financing advocacy, whether it's through support for improving the efficiency of the health spend. We want to be a resource, and we're here to be partners in the journey towards universal health coverage. Thank you.
Thanks so much, Kalipso. Kalipso, I'm wondering if you'd like to ask Githinji a question.
I will, yes, indeed. So Githinji, hi, and nice to see you again.
Hi, Kalipso, good to see you.
So my question to you then is, what do you think the biggest challenges are that we need to overcome to get to the future we want when it comes to global health? Thank you.
Well, I think if I was to look at this, because this, from an African point of view, I think I would say that, and this is SwitchPoint, and I know that I was invited to the last one, and I think SwitchPoint is about controversy as well. It's about doing things differently. So I actually want to be controversial here, and Polly, I hope you allow me. And actually, I like to conclude, and I'll pick up 2 issues in terms of the challenges, the biggest challenges in the future for achievement of those things that you're talking about, Kalipso. I think there are 2 problems. One is sex, and the other one is climate change, and I'll explain. The first one on sex is who owns it, who has it, who controls it. This is really the critical challenge to achievement of global health agenda, especially for the continent of Africa. In my video that ran a little earlier, I reflected on the fact that 90 years from now, by 2090, Africa is going to have 30% of the world's population. That speaks to a rapidly growing population. It's only in Africa, largely, if you look at the 55 member countries, where population growth is still above 2%, some going to 3%, okay? And this has to do with failure of choice, and also the attempt of society and government to control people's sex choices and to control who they have it with and to control how they control it and to control when they need to have it. Now, if you look at some of the countries, and I'll come back to this population argument shortly, if you just looked at the mother's mean age at first birth, and you look at Australia, it's 31 years. 31 years. If you look at UK, it's 30 years. You can say generally for the OECD and the European countries, whatever, it's around 30 years. Now, let's look at a few countries in Africa. Niger, 18 years. Chad, 18 years. Mali, 18 years. That is the mother's mean age at first pregnancy. Okay? Now, let's flip that and look at births per 1,000 women between 15 to 19 years. If you look at that, the average in the high-income countries of percentage of women between 15 to 19 who actually give birth is 1.1%. In fact, in Netherlands, it's almost zero, like 0.4% of women between 15 to 19 who actually give birth. Now, look at Southern Africa generally, it is 10%. Look at, if you look at the countries I talked about earlier, you look at Niger, it's 18%. It is 17% for Mali and Chad. Now, you are therefore speaking about generally a high dependency ratio, intergenerational poverty, and you're talking about a wide gender gap. The wide gender gap is because who is giving this birth? It's the girls. Between 15 and 19, if you look at the human capital agenda, just that, and you say the World Bank Human Capital Agenda, the index, you say it's health plus education, and education is supposed to be available for the longest time possible. I think its target is 14 years of schooling, of high quality, and then health. Now, if you look at those two and you just look at the numbers I've given you, you cannot build human capital if more than 18% of your young girls are giving birth between 15 and 19 because they can't go to school. It's as simple as that. So it doesn't matter what we discuss and what we talk about and what targets and policy and advocacy we give the government to raise funding for healthcare, because as we said, it is this huge population. Secondly, population growth. Third, a small economy which continues to be informal. Because when you have intergenerational poverty, you don't have people who can enter the job market, the formal job market. They enter the informal job market, and you have people. If a woman gives birth at 15, by the time they're 30, they're grandmother. By the time they're 45, they're grandmothers. And therefore, the layers of independence are too many. So that's the first problem. That with this, we'll have high dependency ratio, we have low per capita income, we have high poverty, and this continues because we have failed to give young girls choice. So the future is only going to be different if we can actually address the issue of choice. So that's the biggest challenge to the future of Africa, because even with our per capita income, with this population growth, even if you increase 15% to Abuja, you still end up with $40 per capita. What do you do with that in the health sector? So it is a zero-sum game to advocate for more money. Probably efficiency is the most important thing we need to do. But having more money from $30 to $32 doesn't change anyone's life. We need to address the core architectural issue. The next issue, so that I move on quickly, is globalization. And globalization in Africa has resulted in, number one, product dumping. So if you look at NCDs, non-communicable diseases, now if you look at the rising burden of non-communicable diseases, hypertension, diabetes, obesity, it is largely because of consumption of high sugar and high fat products. But where are they coming from? They are coming from countries where they have been regulated. But because globalization requires free markets, where they are regulated, they then shift to markets that are low regulation. And that is Africa. I was looking at a very simple thing called Kinder Joy, which is a small egg which contains 20 grams of something inside it. It is banned in many countries. Its website have been pulled down. They have 10 grams of sugar for every 20 grams of serving. but it is freely being advertised to children in the countries in Africa. And what will happen? Obesity, childhood obesity, diabetes, hypertension. And if we don't address that, then we have a problem. So globalization has a contribution through NCDs, has a contribution through climate change and extreme climate effects. It has a contribution through emerging and re-emerging diseases, which, as COVID has shown, is going to be our biggest challenge in the future. And it has a problem with changing patterns of existing diseases like malaria, moving from low-lying areas to high-lying areas because of global warming. So this, for me, are the two structural issues, because then there are other many micro, but this is really what I would like to highlight. But we have Edwin here, and Edwin is with the One Campaign, and I think the One Campaign is doing a great job with young people. And I've just talked about these issues of population management, sex, as I want to call it, because when you say population management, it seems to be something that the World Bank is supposed to address. But you talk about sex and the management of sex. What do you think is the pathway, Edwin? And what is the one in Africa doing to achieve the future of health for the continent of Africa? Over to you, Edwin.
Thank you, Dr. Githinji. I think I mean you've talked about the structural issues that are critical, that must be dismantled if we're going to achieve the future we want. And I think you've also highlighted how more money is not the real issue in the sense of the word to deal with the structural issues. But I also want to come back on the point of view of when the house is burning, right? You need to put out the flames first. And so one of the key things that we do as one campaign particularly is to raise the global health finance for the most pressing issues, for preventable death, to prevent deaths that need not happen even right now. And so when we campaign for the global fund replenishment or Gavi replenishment, these are the things we are basically pursuing. And our biggest word here is to pursue global solidarity. And like you've talked about, these structural issues are there, but even in the form of whatever happens in one country does not stay in one country. At least if there's not anything we've learned from COVID, is that it doesn't matter where you are, a virus will travel the world. And so for that reason, what we keep on doing is to talk about, we continue to promote multilateral approach, global strategy to preventing diseases and preventing outbreaks and arresting outbreaks where they happen, because where you live should not determine whether you live. So that's the mantra that we have. And so we continue to raise our voices. We continue to mobilize citizens to demand and to ask that even these countries that have amassed resources over many years should not think that they are safe where they are unless they contribute to eradicating disease and burdens wherever they are in the world. So that's our first pillar. The second pillar is about we mobilize for accountability. Because like you talked about, if the system is broken, whatever we do, even if we pour in all the money, it will continue to be like a leaking basket. And so we campaign for accountability, whether locally within the African continent or globally. We're looking for how will leaders be accountable for every dollar spent to build a resilient health system, so that we do not just put the money there, but the outcomes actually reflect the inputs that we get in. And that's the part we talked about. We continue to pursue transparency and accountability and mobilizing voices, mobilizing young people to really ask questions about this investment that are being made. I know that because, again, I know that we're pressed for time, but I just want to rely on those two. Mobilize the resources to get to where they are and mobilize people's voices to demand accountability. With those two key pillars, we'll continue to drive those changes that need to happen, even while we are still trying to deal with the structural challenges. And with those questions, I would just want to move on to speak to Santiago. Again, Gavi, the Vaccine Alliance, of course, helps to immunize almost half of the world's children. Could you tell us about your work? I know we've constantly supported Gavi replenishment, but could you tell us about your work and the future that you're working, with Gavi towards, so that we can see exactly how this path is moving?
Thank you, Edwin. And first of all, thank you very much for all the support that you're doing by helping us to mobilize resources. Amazing job. So yes, as you mentioned, in Gavi, we made it our mission to help to save life and protect people's health by increasing equitable access to vaccines. Now, I think Sad mentioned this morning that what we have achieved in the last 2 decades. Gavi has helped to reach over 350 million children with immunization. This is an incredible achievement that countries have been able to make. This is through our alliance with partners like multilaterals, like civil society, like One, and also with the African governments, of course, heading those efforts. Now, this has helped to reach children with 300 million children with pentavalent vaccine, over 170 million children with pneumococcal vaccine, which is one of the leading causes for pneumonia, which is one of the leader killers of children. So this has been significant progress. But I think what is important when we look at immunization is that immunization also provides an opportunity to deliver other essential services that not only a child needs for a healthy life, but also the family. Therefore, not only helping us to reach with other primary health services, but also including to help to remove the socioeconomic and gender barriers that many communities are facing. What is the future that we're looking at? When you look at our new strategy, for us, equity remains our primary focus. And that's why what we are aiming in the next strategic period is to reach those 10 million children that they have not been vaccinated by helping countries to increase their access for routine immunization. Now, since we're talking about financing, also want to talk about one of the key elements and one of the successes that we had with our model, because Gavi, in its business model, it has a unique co-financing policy element, which has played a critical role in helping countries to increase not just ownership, but increasing domestic investments in immunization and supporting these countries to transition out of Gavi support. Our vision, our future is self-reliance. We want to see how we can really stop the dependency for it. And if you look at, since we introduced this policy in 2008, countries have financed over $1.6 billion for procurement of vaccines that they're co-financing through Gavi. This is an incredible achievement, particularly when you think about in the past, vaccines and immunization have been mainly donor finance, and which is very ironic because it's one of the most cost-effective interventions. So if there is any dollar that should be spent from budget, it should be on vaccines. And Africa has made a significant progress in this. They have contributed almost $690 million through this co-financing. This is mobilizing domestic resources for the procurement of critical vaccines, which is impressive. Now, particularly as you see, now Africa is basically financing, if you look at the period 2010-2015, from the Gavi, the vaccines that Gavi helped to introduce, they financed 10%. Now, in the last period of 16 to 20, now on average, they're financing 20%, really helping countries to transition out of our support and becoming independent and self-reliant, which is a critical element. And we are seeing, particularly as we look to the future, as more and more countries will be transitioned out of Gavi support, that the mobilization of domestic financing is going to play a very important role. And we see that some of this progress has been basically have set very strong foundations. When we look at the pandemic, that it has a huge economic crisis with it, not just a health and society crisis, we're seeing that countries have mobilized over $130 million to procure vaccines. Therefore, now vaccines are becoming a priority in 4 countries, which is what we believe it should be. Now, I think it would be very important as we go forward to continue to discuss how the impact of COVID will have in the future that we're looking at. But perhaps before we start to that, I would like to ask a question to Polly, because we know that IntraHealth is focused on the health worker. So why is the health worker so essential to your vision of the future?
Thanks so much, Santiago. I mean, as you know, IntraHealth has been focused on health workers for over 30 years because we believe that health workers are actually critical to everything that we're doing. I mean, Santiago, vaccines cannot be delivered without health workers. So really, we cannot reach those that are underserved, those that the unvaccinated. We cannot talk about sex and reproductive health unless we have health workers and community outreach workers to reach those in need and make sure that we all have the information and the services that we need, including in hard to reach areas. So we conducted the Future of the Health Work in Africa, this work, so that we could try to anticipate where the world was going with the health workforce. We did this before COVID, of course. And I think that what COVID has taught us is just reinforced the reasons why health workers are absolutely so critical. You know, we see in countries where there are robust health systems and a health workforce that has been redeployed to meet the needs and emerging threats of the pandemic, we've seen that essential services have not diminished as much as in countries where they're not as strong as a workforce. So we think that like gatherings like today are so essential to engage young people, health workers, and global leaders in strategic forecasting so that we can be sure that there is an adequate health workforce that are supported, connected, and ready to help everyone achieve their goals. And I think that, you know, this discussion today on financing is absolutely so critical because often in many campaigns, vertical initiatives, we get funding for pharmaceuticals, funding for goods, things, but not funding for, you know, the health work and the health systems that we actually need. And I think the issue of domestic financing is key as well. And so I really appreciate this robust discussion on, yes, we need to attract the global financing now, but we also need governments to prioritize this and to ensure that that funding is being allocated really effectively. So, I mean, we need to make decisions. Do we need new clinics or do we need systems and do we need to spend much, much, much more efficiently? And Dr. Gitahi, I think that, yes, I'm so glad that you're challenging us saying, okay, funding is one thing, but we need so much more. These structural issues continue to hinder our ability to move forward. And I agree that globalization and climate change is affecting all of us and increasing poverty in ways that we're still just trying to imagine right now. But maybe I'll like to turn to a specific question to Kalipso, I guess, right now. I think, could I ask you, what are the specific funding challenges? We've spoken about them in a broad sense, but what are the specific funding challenges it needs when it comes to achieving real change? And how can we all make this happen together?
Thanks, Polly. I mean, let me start with the bad news. There's multiple challenges for Africa when it comes to health financing. And of course, COVID has made things much worse. So the World Bank and the IMF estimate that 52 countries, many of them in Africa, are likely to get to pre-COVID government spending levels over the next 5 years. So this is really tragic, and need to be realistic and pragmatic about our ambitions for significantly increasing domestic resources for health in this challenging context. On the other hand, health is very important when it comes to the global economy. Nobody can dispute that. And so COVID has really put the financing of healthcare right at the front and center in the political agenda globally. All countries in the world are suffering. And financing of healthcare is primarily a political decision. We know that. And COVID has provided an additional challenges. Countries will be looking to effectively even other sector spending as COVID-19 restrictions ease in the short term, and boost the health sector subsidies. But at the same time, this is an opportunity to leverage this terrible crisis to enhance and sustain the commitment to the health sector. We know that countries spend a lot more on health over the past year or so, and this needs to be sustained and it needs to be done in a way that targets the neediest. The Abuja Declaration in 2001, where African governments came together and set this target of 15% of government expenditure being spent on health. But that hasn't been achieved. Only a handful of countries have achieved that. In fact, 19 African governments now spend less on health as a percentage of their GDP than they did back in 2001. And another 19 governments, different to the above, spend less on health as a percentage of total government expenditure than they did in 2001. These are negative trends that need to be reversed if we want to be serious about sustaining, supporting, progressing towards universal healthcare coverage. We at the Global Fund continue to work with the Africa Union Commission through the Africa Leadership Meeting and the Initiative on Domestic Financing for Health, which supports countries in Africa to ensure that domestic financing for health is right at the top of the political agenda, where it ought to be. But still, the pressures are immense. In low-income countries, the poorest countries, especially those that are not projected to grow in terms of government expenditure over the next 5 or 6 years, they will see their average per capita spending on health drop by 12% between 2019 and 2026 to an average of $12 a day, $12 per person per year. So this means that the average health spending is less than half what would have been expected for 2026 based on the trends before the outbreak, before the pandemic. Similarly bad situation for lower middle income countries as well. So financing levels, finding the space in budgets to prioritize health, the political will and the money to prioritize health and spend on health is a big challenge. Maintaining donor support is another big challenge. There's uncertainty about donor funding. Donor funding is not effectively a certainty. In fact, it's been flatlining over the past few years, and more recently, it's even been dropping. And that's really worrying in a sense, though, because it's not being made up through allocation of domestic resources. We at the Global Fund next year are launching our replenishment campaign, and it will make it absolutely critical that for the three diseases, TB, HIV, malaria, and the health systems that are needed to support these diseases, and more broadly pandemic preparedness across Africa, that resources are raised and committed appropriately. We will be calling upon our partners, all of you, to support this effort. And here's an opportunity to align, to work better together with colleagues from Gavi, from elsewhere, to support countries in a coordinated fashion. And the Global Action Plan, for instance, under the auspices of WHO, is really a good initiative of supporting fully, and I know Santiago is and Gavi is, sustainable financing for health. So in order to do all of this, however, we also need to make sure that the resources we do have are spent efficiently. We need to understand what we're buying for our money. We need to target those who are in greatest need. And for that, we need evidence, we need data, we need systems, which also encourage the introduction of good value innovation that can be deployed given the systems that are available and where it's likely to do the most good. We also need integration of health systems. That, again, is very important, bringing programs together and integrating, using economies of scale and scope where possible. Now, we don't have enough time to go into all the challenges, but I want to mention one more, which I think is absolutely critically important, and it doesn't have to do with money. Today, we're still battling against stigma and discrimination that in the Global Fund isolate what we in the Global Fund refer to as the key and vulnerable populations. And it's absolutely difficult, it's impossible without changing these long-held social attitudes towards sections of the population that suffer the most. It really even makes it even harder to have to battle against legislation that exists that actually proactively supports stigma and discrimination, and this needs to change. So with that, I'll turn to Githinji with a question. How do you think COVID-19 has changed the future when it comes to global health, health economics, and specifically domestic health financing? Thank you.
Yeah, thank you. Thank you very much, Kalipso, and very important points there. And I think, there are many things to think about during COVID and post-COVID, as you've highlighted, and what is going to happen to domestic financing. Of course, we know also that whereas, partners like Global Fund and Gavi are very well integrated in the national health budget, not all funders and partners are well integrated. And I think that's something we need to address, to say that there is importance in integrating with national health financing so that we move away from funding to financing. And that's what you're doing. And I must thank both Global Fund and Gavi for that, because you're contributing significantly. Now, coming back to the question and looking at vaccines, one of the things I would like to highlight is this, that from what I said earlier about the minimum funds available, there are many dilemmas that meet us. So we continue to push, and I'm one of those who is pushing governments, and I'm supporting the Africa Leadership Meeting on health financing to increase financing, to increase health financing. So that's a constant. As Edwin was saying, we have to put off the fire. So we continue to do so, even as we raise the structural issues that need to be addressed. If you look at vaccine, for example, and I'm sure Santiago will bear me witness, and a low-income country will need to increase its total health budget, total, not just for vaccination, total health budget by 57% to manage to vaccinate 70% of its population. It needs to increase its actual current total health budget by 57%, because you're operating with the numbers that were shown earlier of $30, $40 to vaccinate. I mean, it's inextricable. A high-income country will only need to increase its health budget by 0.08% to vaccinate 70% of their population. So you can see the dilemma is real. The dilemma is real. And therefore, even as we look at increasing the budgets, then we must actually ask ourselves that as we advocate for more, as we advocate for government to put more, I remember having a meeting with one of the presidents in Africa and saying, why are you not giving money to health? Why are you not increasing? And he asked me one question. He asked me, do you think education of girls is important to health? I said, yeah, absolutely, because girls who are educated are more likely to adopt family planning. They are more likely to have more healthy behavior. Women who are educated are more likely to take care of their children and provide them a healthy environment. He said, yes, that is why I'm putting 35% of our national budget on education and putting 7 on health, because the education investment on 35 will give you better health outcomes. So you can see the dilemma that we face even when we're advocating for this. Because even during COVID, one of the things which has been very, very clear is that all hands have to be on deck. Health is too important to be left to the health sector alone. Health is important to be left to the health sector. And therefore, the education sector must come in. Sectors like water and sanitation, the sector on environment, the sector on education, all these must come together to achieve the health goals that we achieve. And if you look at health achievements in Europe, they're largely driven by actually changes outside the health sector. Even the decline in child mortality that we've achieved of 50%, a lot of it is driven by socioeconomic features outside the health sector. The next thing that I would like to say here is that global health has learned that whereas global health is global, it must think local. Change happens in the local sector. And everything we do must think local and think, what are we going to do to that nurse currently who is actually looking for PPE right now as we speak on SwitchPoint? What are we going to do to that patient who is waiting for the cylinder of oxygen to be moved from one patient to that patient? We can't change that here, but we can change it here by thinking local and thinking, how do we change the local health systems, increase their efficiency, and move them more towards 2 things, equity and primary health care. Choices must be made. When you have such a little money, even at home, we decide what to leave out and what to buy. You can't keep the same budget after you've lost your salary. The question is, with the little money, how do we reduce, make choices, and push the money where we have the biggest impact? I think I would like to stop there because I'm seeing we're running out of time. But Edwin, maybe back to the conversation that we had. I don't know how much time we have here. What do you think young people can do to make the big difference in creating the better future we are discussing here?
Thank you, Githinji. In fact, it looks like you were speaking out of my mind, or it looks like my mind was on the screen and you were reading it. I agree with you on the issue of we think global, but we act locally, and that is so important. And I think one of the key issues, or one of the way we've approached this, is about accountability at the local level. I want to give an example. In Nigeria, we ran a campaign called Make Nigeria Stronger, and the aim there was to call for the provision or for the enactment, the implementation of a law. The law took 10 years to pass, right? It took 10 years to pass the National Health Act. The National Health Act was supposed to be the be-all and all for health system strengthening and revamping and reform in Nigeria. But it was passed in 2014. By 2016, not a word of that law has been implemented, not one word. So again, it comes back to accountability. So in terms of the funding for the health sector that we all talked about, COVID has made it clear that without health, there is no economy, right? And I also agree that we've also seen that many of the health outcomes that has improved over the years has mainly been driven, or at least it can be correlated by the socioeconomic improvements in the individual at the household level. And so great as all of these things are, but I think Polly actually said something about, I think it was Kalipso, I'm sorry if I got it wrong, that talked about this is primarily a government-driven service. Health is supposed to be a public good. And because it's a public good, we need to demand it. And so my biggest challenge, and the reason why in our work with young people, is to demand accountability, because apathy would never give us the result we want. And like you said, Dr. Githinji, there are too many competing issues that are looking for resources. So unless we also demand and place health at the center of our economic well-being, and in terms of the center of human capital development, we may never be able to get the result and the future we are looking for. And so for that reason, in view of the choices that have to be made in low resource settings, like especially across Africa, it requires a lot of accountability. This is where we bring the young people. There are many. Africa is the youngest continent, and because if they're able to come together and develop that pressure that makes it politically costly for that for the decision maker, not to denigrate or put health at the lower rung of their priorities. To that extent, we can get better investment and better accountability. And to that extent, and that's why you see us mobilizing a lot of young people and empowering them, training them, giving them the tools to be the voice of accountability. I think that's our approach, and we already begin to see the result, because after 2 years of campaigning in Nigeria, the Basic Healthcare Provision Fund showed up in the budget, and it's currently in the budget. And of course, all of the local contribution to vaccines and to the Global Fund, everything else that we've seen are also beginning to happen. So that's where I would put it. But again, I'll come back to Santiago. Again, we're in the pandemic. It is not over, right? And so, and the vaccine needs to get everywhere in the world. So we know Gavi is a part of COVAX, or is driving COVAX, and they're going to play a pivotal role in making vaccines reach everywhere. So the question is, what else? What is really happening in that space, and how else can we? What should we be expecting, especially with COVAX going forward, to end this pandemic, basically?
Thank you. Yes, we're not over yet. We still have a long way to go. So when the pandemic started, we really look at what is the role of Gavi, and particularly thinking from an equity perspective. And it was clear right away that the only way that we could really defeat this pandemic was if we had a global action. We needed all partners, all countries to join effort to defeat this pandemic. So what we did is we created the COVAX facility for every country to participate. We developed a wide portfolio of vaccine candidates. We have to remember now, it doesn't sound like reasonable, but a year ago we didn't have a vaccine. Now we have several vaccines, but a year ago we didn't know if there would be a vaccine, when, which one. So that's why we created a wide portfolio of vaccines. So what have we done so far? We first fundraised $10 billion to support the 92 most vulnerable countries. So financing was not going to be a bottleneck to receive COVID vaccine. So that was the first, and we were very thankful to Juan and to all of our donors and civil society that we were able to reach that target. Now, so far we have delivered over 300 million doses in 143 countries of COVID vaccine. Now, if you look at in Africa, it's almost 90 million doses that we have delivered in 50 countries. So this is still a significant amount, but far from it. The good news is that we are increasing the pace. If you just look at September alone, in September alone, we delivered more doses than in the first 6 months. So if you look at just Africa alone, in September, we delivered almost 20 million doses. So, but still, it's a bad news, which is we are far from reaching this equity goal. So we have only access to vaccines. If you look at low-income settings, only 2% of the people have received a first dose when you compare with 66 in the wealthy nations. That's unacceptable. It's unacceptable also that in Africa, we're only seeing that 2.3% of the vaccinations are happening in Africa, and it's only around 6% of the population. So what are we doing? First, we are asking manufacturers to be more transparent about the production schedules. Manufacturers have a critical role and responsibility in ensuring equal distribution of vaccines. Also, we're asking these countries that have high coverage and that also have pending orders of additional vaccines to swap those places with COVAX, so we can prioritize those vaccines to the countries that need it the most, because we have the agreements with the manufacturers to supply those doses. And finally, we are also asking those countries with excess doses to donate them and to give it to us, so we can really in a predictable way, so we can share with all countries. We believe, if you look at the supply landscape, that we will be able to, this year, to deliver over 470 million doses in Africa, which will help us at least to reach or to be very close to reach our 20% target of all the population. But we still have a far way to go. And as Polly mentioned, vaccines are not delivered alone. And therefore, one of the key elements that we need to really look is at the preparedness. We need to help countries to be prepared to introduce these vaccines. This includes investing in the workforce, planning, and all the different activities. And for that, we are also providing an additional $1 billion to the 92 most vulnerable economies to help them prepare. But we still have a long way to go. And one of the key elements that we should all reflect, I think as Kalipso mentioned, is we still haven't seen the full impact of the economic crisis, particularly in the health sector. Now, as she mentioned, low-income economies will need the next 4 years in order to reach pre-COVID levels. This means that there is a greater risk than before in terms of less resources for the health sector. Therefore, we need bold action. This is a must. We need to have bold actions in order to have government health expenditures not to decrease in African countries. And for that, we need collective action. We need civil society. Edwin, as you say, we need to ensure accountability. Those are the critical elements that will really help us to maintain the gains that we made in the sector, but not only that, because those gains were not enough, but also to improve them. So, and that's why perhaps I would want to ask Polly, when you look at also the future and the next generation of global health leaders, of global health workers, what is the future that you're working towards?
Thanks so much, Santiago, and thanks again for everything that you are all doing to ensure that there are funds for readiness in countries that need those funds to help them get ready so they can actually deliver these vaccines. It's absolutely critical. So when it comes to the health force, what are we looking for at IntraHealth? I think that we're pushing for health workers to be properly paid, to be supported, to be connected, to be trained and ready to be protected. And when it's trained and ready, we're also, and this leads into accountability in governments, right? We want them to know where their health workers are and to allocate them really effectively and optimally so we can ensure that health workers are where they need to be. So that's critical. And for that, we need data. And data leads to accountability, transparency, and efficiency. And that translates to the health workforce as well. So we're really pushing on that. And then what has COVID-19 taught us? So many things. But with the health workforce, clearly it's highlighted to the world how important health workers are. But it's also really accelerated this move for self-care. This has been a trend for some time, but this move to self-care has been put on turbocharge with COVID-19. So the importance of community health workers is more important now more than ever. And these need to be formalized and they need to be integrated as part of a formal healthcare system, because as care moves into the community, including vaccinations, that possibility is there. We have an army of health workers at the community level. And how do we ensure that they are supported, connected, supervised, paid, so that they can be an effective part of this system? So that's why I think continuing to conduct these conversations is absolutely critical. And I think I wanted to take a few minutes, since I do have the mic right now, just to sum up some of the incredible things that I've heard throughout this day, and especially from this panel. I keep hearing equity, equity, equity. It's so important. We need to find the unvaccinated. We need to find the vulnerable. We need to find the women that need access to reproductive health services. And we need to ensure that all of this is done in an equitable manner. The need for financing is critical, and international donor financing is not sustainable and it's not enough. So domestic financing, there needs to be more of it, and it needs to be transparent and used in the best way possible. So I think that's absolutely critical. And thank you. Thank you, Kalipso, for that, very frank but honest and frankly dire assessment of where we are in terms of domestic financing because of the impact of the COVID-19 pandemic on governments. So we urgently need, I think many of you mentioned youth advocacy, and that really is the theme today. So all of you youth that are listening today, we need you to come to the table. We need you to work with governments and call for accountability, transparency, and increased investment in health. And thank you, I think it was Dr. Gitahi and also Edwin mentioning that this is really a multi-sectoral issue. I think all of you have talked about that. So we certainly don't want to take money from education for health, but we need to ensure that governments are looking, throughout their sectors and ensuring that we have the resources where they're needed and really used in the most effective way possible. We need to target stigma and discrimination. That was mentioned once. I think that's critical. So I'll mention this. And then also, Githinji, thank you so much for really pushing us that, yes, it's about financing, but it's about so much more. These structural issues. It's about sex. It's about reproductive health care, which is so critical. Reaching those that are in need, giving women choices. As a woman myself, I absolutely have always been an advocate my entire life for that. And then climate change and other forces that are negatively affecting all of these economies are critical issues. And we know there's a lot of happening on the global stage. We need there to be more. So all in all, this has just been a fascinating discussion, raising many, many concerns, issues, but also really a path and the way forward. And once again, youth are really at the center of ensuring that you hold us all accountable for doing the most and the best that we can do with the resources available and to push for more all the time. So I look forward to continued conversations. Thanks so much for being with us today. And let's stay on to hear the rest of the speakers for the rest of SwitchPoint. Thanks.
Thank you.
Thank you. Thank you, everyone.